Right, good morning, Chair Postman, members Garrett Vollendorf, staff and guests. The lobbies are open and the recording has begun.
Thanks, Justin. Good morning, everybody. We'll convene the board caucus meeting for Tuesday, March 19th, 2024. First item up today, we're going to be briefed and discuss reports from the Washington State Institute for Public Policy, which is charged with looking at us. And I'm going to turn it over to member Vollendorf to kick that off. Nope, can't hear you. Can't hear you.
Thank you. Sorry about that. Thank you, Chair Postman. I am excited to introduce everybody to Amani Rashad from the Washington Institute for Public Policy. Shortly after joining the board, I reached out to WISIP to get some more information about a series of reports that WISIP was tasked with once the citizens of Washington passed Initiative 502. And so I've invited Amani to come and give us a background of the reports that they've presented, and then to regularly come back as WISIP does additional reports in the future. So before I turn it over to Amani, I just wanted to give a little bit of background here just for the record. So in November of 2012, Washington state voters passed Initiative 502 to regulate the tax and use of cannabis for persons over age 21. As part of 502, WISIP was directed to conduct cost-benefit evaluations of the implementation of the law. The evaluations must include measures of impacts on public health, public safety, cannabis use, the economy, the criminal justice system, and state and local cost and revenues. A preliminary report was released in September of 2015. A second report was released in September 2017, and a third report was released in September of 2023. The last mandated report is due 2032. In addition, WISIP produces additional reports on an ad hoc basis, which I'm sure that Amani will talk about. So Amani, I hope I didn't steal any of your thunder and any of your background, but I just wanted to set the stage for what you were going to present today. So thank you very much for coming, and we hope this is the beginning of regular conversations with you and the work that your team does.
Thank you so much for that introduction, Jim. You did not steal anything. You set everything up just fine. And I'd like to thank the board for having me and allowing me the space to present on the work we've been doing in 2023. As Jim mentioned, we published our third report, and we published a couple other reports, kind of a bundle all together. So we'll be talking broadly about all of that work. So I am a researcher at the Washington State Institute for Public Policy, and since January of 2020, I have been the lead of this long-term evaluation for Initiative 502. So before I jump into that, I would like to take a second to talk about the Institute. So Washington State Institute for Public Policy, or WISIP, is what a lot of people know us by. So we're a small, nonpartisan public research group. So I realize I didn't share my screen, sorry. Can you all see? Excellent. Okay. So as I said, we're a group of researchers. So research is what we do. We're pretty multidisciplinary. So we have experts in all backgrounds. We get assignments related to health, substance use and public health, criminal justice, education. We do benefit cost analyses, meta evaluations, economic impact analyses, list goes on and on. So we're pretty broad in our toolkit, and our projects are primarily initiated directly through the state legislature via policy bills or budget provisos. Our board can approve non-legislatively directed work. This has come up probably most frequently. Sometimes agencies want to contract with us to evaluate programs that they run, so that can be done as well. Or in the case of Initiative 502, which is possible, but I would say not the most common way, is by citizens initiative. So as Jim mentioned, we were written into Initiative 502, and it is to conduct that benefit cost evaluation covering outcomes related to public health and healthcare, public safety, substance use, criminal justice, economic impacts, and administrative costs and revenue, along with these 4 defined deliverables. So the most recent one in 2023 is what I'll present on today. And then our work will culminate in 2032, and that'll be that benefit cost evaluation. So all the work we've been doing and the work we'll continue to do in the intervening years is all laying that foundation for that final benefit cost. And the way this works is it's not just these four as kind of one-offs. We get funding on a continuous basis. So the research is ongoing. So we hit these four deadlines, but in the background, again, as Jim mentioned, we are still doing work, and we will publish reports as relevant. So at the end of the presentation, I'll talk a little bit about the work we're doing now. Okay, so 2023 was a busy year. So the first report we published was a 10-year review of non-medical cannabis policy, revenues, and expenditures. So this is a purely descriptive study that we published in June, and it served two purposes. One was to summarize relevant policy, so kind of the landscape, some of the market regulation, and then also relevant policies that have passed since I-502 has gone into effect. And then we also did a high level summary of kind of the revenues and expenditures in and out of the dedicated cannabis account. So with this one, a thank you to the LCB. Actually, we worked with several people for help navigating the finances and also just kind of fact checking all of that policy. So Mary Sagawa actually reviewed an early draft of this and, directed us accordingly to different contacts. So a thank you to the LCB while I have your ear. And then the next report, so this was our report 3, this was our major outcome evaluation, and it looked at Initiative 502 and cannabis related public health and safety outcomes. So with this study, we first looked, overall the big picture in Washington before and after, and then a lot of the study really zooms in on the retail aspect of Initiative 502, and we focused primarily on how retail access relates to a plethora of public health and safety outcomes. And a lot of that work focused on legal-aged adults. So continuing this work in December, we published a report that focused on retail access and high school outcomes. So focusing on adolescents in particular and what's going on with that landscape. So that's a little bit of the 2023 overview. Okay, so first step is just, as I mentioned, kind of that zoomed out big picture, a national comparison, and in particular using survey data. What we did is we just examined how reported cannabis use, and we were able to look at other substance use, how that changed. So we're looking here before and after Initiative 502 went into effect. For two age groups, we were able to look at legal-aged adults separate from those 12 to 20. So we looked before and after Initiative 502 went into effect. And then we also separately looked before and after commercial sales started. So before and after retail commenced in July of 2014. And what we're doing here is we're kind of comparing how did reported cannabis use in Washington change relative to similar states over that same time period. And with this study, we did not find any evidence that reported cannabis use changed in Washington before and after the passage of I-502 or the advent of retail when compared to similar states over the same time frame. And we find no evidence that a reported alcohol, cigarette, or other substance use changed. So here, when we look at that kind of big picture, Washington overall in the national landscape, we don't detect evidence of significant changes in reported cannabis use behavior. But in this case, especially focusing on kind of the retail aspect, we focus on retail. I mean, this is obviously a large part of Initiative 502. It's the means by which we can acquire cannabis legally, but also many other studies have found that it's the retail component that tends to predict changes in outcomes more so than just legalization itself. So we focus on that. So with this study, we're just looking at this one point in time, but we know that the market didn't just fully form in July of 2014. It's not like we woke up in the morning and we had a full-fledged market. Retail has rolled out over several years with varying accessibility across regions. So I point this out because with that study design, our kind of first pass, it can be difficult to really speak to the true relationship between retail and outcomes in Washington state with this single point in time analyses. So moving forward, we kind of get away from that, drawing the line and just looking before and after. And instead, given that it rolled out, given that different parts of Washington have different access, even to this day, we consider that the impact of retail on cannabis use may differ depending on that accessibility. So to look at retail access, we actually use data from the LCB. So this is information we got from you all, and it's licensed non-medical cannabis retail info. And in particular, we got addresses and then the first and last sales date that we see. And the idea here is we want to see, okay, where are retailers and roughly when did they start operations and when did they close if they're no longer operational. So this is the kind of foundation we need to measure access in the state. And our primary definition of access is the average drive time to the nearest retailer for the average resident in a geographic unit. So depending on the outcome, we can see zip code, census tract. The idea here is we're kind of trying to find neighborhood or local effects, however we're able to measure neighborhood. So this map should better motivate that what we mean when we talk about access that way. It's actually pretty straightforward. So this is a map of zip codes in Washington in 2019. Each red dot is a licensed non-medical cannabis retailer that was operational in 2019. So notably, our map doesn't include tribal retailers, and we also don't have information about retail in Oregon. We know that along the border, those who live along the border can access retailers in Oregon as well, and we just don't have those information at the moment. I pointed out because those emissions could lead and likely do lead to us underestimating what access actually is a little bit. It is what it is. I think that the licensed retail market is probably the primary access anyway, and moving forward, we'll see how much more we can take into account. But so we mapped out all the retailers, and then using population data from the census and partial data from OFM, we're able to roughly map out where people actually live within zip codes. And what that allows us to do is then say, okay, so given where people live in this zip code, on average, how far does someone need to drive to get to their nearest retailer? And that right there is our measure of access. So on the map, the darker the blue, the further they need to drive to hit their closest retailer. So for example, how do you interpret this? So here in light blue, that's a zip code in Olympia, where I'm living, where I am at this moment in time, and it's light blue. So what that's saying is in that zip code, the average person doesn't need to drive more than 10 minutes to get to their closest retailer. But then if you go out here to a zip code in, I believe that's Ferry County, it's really dark blue. So what that one is saying is actually the average resident would have to drive at least 45 minutes to get to their nearest retailer. So when we talk about how access is not uniform across the state, like this is what we mean. Depending on where you live, we have differing access. In addition to that, our data also we're able to look at access changing over time. So this is just a still from 2019, but even in Olympia, in 2014, access looked really different to what it looks like today. The market has grown over time, and we're able to look at that over time. So what we're essentially doing is like systematically, as access changes, as retailers become more and more accessible, do we see coinciding changes in cannabis use behavior and other related outcomes? So before we answer that question and jump into those results, I do want to point something out. So it's pretty obvious just looking at the map where retailers locate is not random, right? Where there's more population, there's more retailers, that's by design. But even within a locale, retailers, when they're deciding where to locate, they take into account things like rent and anticipated demand. And in addition to just what we can see geographically, when you look at, so what we did is we looked at demographic and socioeconomic characteristics. So this is in 2019, this is the characteristics of zip codes that have an operational retailer within their boundaries and zip codes that don't. And even across these comparisons, we do see some differences. So for example, zip codes with operational retailers versus those without tend to have a smaller percent population white, but a larger percent population Asian and Black. So these differences are small, they are significant, but they are quite small in magnitude, just a couple percentage points. But we also find that where there's an operational retailer, those zip codes have a higher percent population with a bachelor's degree, a higher percent renting as opposed to owning homes, and a higher median household income. So differences are not crazy, I would say, but they are still significant differences. All of this motivates, since retailers are systematically choosing where they are and it's not random, we are not able to establish true cause and effect relationships. Our study doesn't say a retailer opening near residents caused increases in cannabis use. What we are able to do is we account for all of these differences, and we do our best to try to isolate the correlation or the relationship between access and outcomes. But again, in a world without random assignment, it's hard to really speak to cause and effect. So I just really wanted to point that out. It informs how we interpret all of our findings moving forward. Um, but without further ado, jumping in. So our first look was just to look at how access relates to cannabis use within the state. So we're using survey data for this. And we find that a shorter drive time to a licensed retailer does among legal aged adults actually does relate to a greater percentage of reported cannabis use. So for example, if you reduce drive time to a retailer by 50%, that corresponds to an 8.6% higher probability of reporting past month cannabis, heavy past month cannabis use. So heavy past month cannabis use is about 20 out of 30 days. So this is a modest relationship. It's small, but significant nonetheless. And now that we've established that greater access does predict higher rates of use, we then look at other related outcomes. So we first look at fatal crashes. It's the same idea. Is what we're looking at here is within a zip code, within a neighborhood, as access increases, does the prevalence of drivers from that zip code involved in a fatal crash change? And sure enough, we do find that a shorter drive time to a licensed retailer relates to a modest increase in the number of drivers involved in a fatal crash. So it's similar, about a 50% reduction in drive time led to about 6% more drivers. And more importantly, about 40% of drivers in a fatal crash receive a blood test. And among blood tested drivers, we found that a shorter drive time predicted a higher prevalence of drivers who test positive for THC. So we are seeing that specific mechanism did go up as well. Next, we looked at substance use disorder diagnoses, how retail access relates to that. Among Medicaid claimants, I just want to point out our data was Medicaid claims, so this is not to be generalized to all of Washington, but among this population, I think that's roughly 30% of Washington is on Medicaid. So for this same thing, we looked at a couple things and we find right out the gate, shorter drive times do relate to a higher probability of cannabis use disorder, alcohol use disorder, and opioid use disorder. The relationship similarly is small, about a 50% reduction in drive time is a 2.3% higher likelihood of a cannabis use disorder diagnosis. And then, so with this one, we actually looked at kind of like an alternative measure of access. So far, we've defined access as the drive time, right? The further I have to drive, the more costly it is for me to buy cannabis. So that's kind of the simple access. But what we also want to look at is density. So more retailers nearby, does that predict changes in cannabis use behavior as well? So this would work a little different. I think the idea here is if the more and more retailers nearby, the more competitive the market is. So numerous retailers can lead to lower prices. It can be more variety in product and more advertising. And it's through those channels we might see that greater density could also relate to differences in cannabis use behaviors. And sure enough, we do find that more nearby retailers within a pretty small radius, only 5 to 10 minutes. So in really dense areas, as you increase the number of retailers, we do see that that does predict higher and higher probabilities of cannabis use disorder diagnoses. And then the last finding I want to highlight here is that access, this is one of the few cases where we were able to look at underaged groups within the data just because we actually had that population. And we did find that a shorter drive time did relate to a higher probability of cannabis use disorder diagnoses among adolescents aged 12 to 17. So we have this finding, and I think from there we pivot to look at kind of take a deeper dive into retail access and adolescence. So our last report looked at retail access and high school outcomes in particular. So here we're looking at 9th through 12th graders, it's high schoolers in particular, not younger ages. And for this, before we jump into the results of this study, I do want to highlight, so when we think of access in adults, it's pretty straightforward. As a legal age adult, I drive to the retailer and I purchase cannabis. The relationship between retail access and adolescents would be a little different. So we're not thinking here that the adolescents are driving to the retailers and buying from retailers. That's not, there's no evidence that, mainstream that's happening. That's not how it works. So it's a little less direct. I think the most obvious channel here would be access through legal aged adults. So more retail means their parents might have more in the house. They might be able to get it through legal aged friends or siblings. So it still can supply, it still can create that back channel supply. And even more indirectly than that, if there are retailers nearby, then there might be more advertising. We know since cigarettes that adolescents respond to advertising. And last thing is just it being around, seeing more adults use it. It could possibly normalize cannabis use and lower perceptions of risk. So with adolescents and retail access, what we're thinking here is more of a spillover, not so much this direct youth are going to stores and buying cannabis. Um, and sure enough, so we are not the first study to look at this. We did redo analyses that other studies have done using healthy use survey just to see if we can, if we find similar results. And sure enough, here, what we're doing is we're looking at schools and comparing students who attend schools near retailers to students who attend schools not near retailers, right? So that's how we're measuring access here is via the school. And we do find that when you compare those two 10th and 12th grade students that attend a school nearby an operational retailer are more likely to report frequent past month use. So we did see some evidence similar to studies that school access to retailers predicts a higher rate of reported cannabis use among 10th and 12th graders because that's who's in the survey. So from there, we look at other high school outcomes, which allows us to look at the entire population of high schoolers. And here we looked at cannabis-related disciplinary action, attendance, and high school graduation. And to highlight a few of the key findings here, students who attend a school nearby a retailer have a 7% higher number of average monthly unexcused absences. This was across all high schoolers. This was our most robust finding. So we didn't see changes in excused absences, but we did consistently see this, which could be indicative of more truant behavior. And we did find that students attending a school near a retailer have a 2.5% lower likelihood of graduating high school in 4 years. So only like on-time graduation is what responded. This was driven completely by rural region comparisons. So in urban regions, this doesn't hold. And then similarly, we did find that density. We looked at density here, so more retailers did predict kind of more and more unexcused absences as well. So that's the work we did in 2023. It's a lot of findings. I think that, it distills down to when we looked at the national landscape, we didn't see much going on, but zooming into the state, looking at retail, there do seem to be some patterns between access and adverse outcomes. More research needs to be done to better understand why and how and account for more characteristics. So the last thing I want to leave you with is kind of the forthcoming work. So what we're working on, as we mentioned, we're going to keep working, we keep getting funding and we keep doing work, and we'd love to keep working with you all and present and keep you updated. We just started expanding healthcare work. So we have more Medicaid claims data and we want to look at other outcomes like cannabis related ED visits and hospitalizations. We also have behavioral health outcomes. So psychotropic drug prescribing behaviors and diagnoses for related mental health outcomes like depression and psychosis and mania. So we'll want to look at that. We'll want to update through 2023. We at some point we have to tackle the pandemic. So we're working with LCB now. Actually, I've reached out to the research manager to try to understand or try to, get more retail data, update our maps through 2023. And then way in the future, we haven't started this work, like the healthcare work is slated to publish in 2025. So we're doing ongoing work. And if you want to hear updates along the way, just let us know. But September 2025 is what we're aiming for. Something that the deadline is less defined, but it's definitely next on the list is to start looking at labor market and workplace outcomes. Those are specifically called out within our assignment language. And so we want to look at workplace safety implications. And I think in 2017 had a descriptive report about cannabis employment and wages. And I think we worked with the LCB. This was before my time, so my predecessor would have worked on that paper. We'll want to update that work. So we look forward to working with you all more on that in the future. Um, Yeah, so this slide was for you all. It's just the links to all the papers, everything that I talked about today. This is a guide for you to follow to find the actual reports. And yeah, not sure how I did on time, but happy to take questions.
Great. Thank you so much. That was fantastic. And I really appreciate the detail that you provided on the most recent report and the overview. I think, so first of all, you mentioned our research team, Amani, and I wanted to make sure and just it sounds like you have connected with our research team that we've started. And I think that that's an incredibly important part. I think board member Garrett mentioned that when we talked about having you come and present, is making sure that we wanted to make sure you were connected with our research team and looked for opportunities for collaboration. I think that's incredibly important. You know, I think that when I look at all of the work that you've done and the work ahead, I do have questions about, like, and I'm calling them ad hoc reports. I don't know if that's how you would describe these reports that are in between reports. I'm a little unclear about, like you mentioned here, ones that are coming in 2025 and what you're looking at in the pandemic and psychosis, and how do things get on your radar for those? And like if, yeah, just curious about how specific topics get identified between required reports?
That is a great question. So I think that in the background, all the first kind of sniff test for every topic is here's the assignment that's covers a lot, and then here's this 2032 goal. So these things are chosen in part to hit the scope. So like, for example, healthcare on our end is getting a lot of attention because it's called out so much in the assignment. And
Yeah.
like labor markets on our radar because that's also called out. And ultimately, like the specifics of it also have to do with how it can integrate into a benefit cost. So there's a little bit of like what outcomes can be monetized, how does that work? But so it's kind of this combination. So the main thing is just, is it in service of the actual assignment? Because there's a lot of interesting topics. Some of them we just have to pass on because they're less prioritized. And then the
Mm-hmm.
other thing in the background, a big one is data. This is an empirical study. We have to be able to actually evaluate the outcomes and put them into a benefit cost. So anything I don't have data for, I can't study.
Right. Right.
So that's another big one in the background. And then the last one, in terms of the timing of the interim reports or how ambitious what we're covering is, to some degree, that's also internal resources. So we scoped a project for like a natural September 2025. We're like, this is what we can do. This is with our staff and resources. So that's what's a little bit dictating the timeline of the interim
Great. Thank
work
you.
we're doing. Yeah. So great
Thank you.
question.
Other questions from other board members?
No questions, but thank you. This was valuable information.
All right. I do have just one final comment, and that is that we have, again, this new research team. One of the things that I'm hoping to spend a little bit more time with our research team is how do we use the reports that you guys are putting out? What do we do once we're on the receiving end? And part of it is having you come and present, and then ways in which we can, look at the data and how does that impact public policy decisions. And so I'm hoping that we can continue to engage as questions come up and that kind of thing, and just looking forward to continued partnership with you.
Yeah, I totally agree. Again, thanks for this opportunity and thank you all for listening. I think that there's room for our results to meaningfully inform your work. And then I think another side with the research team that I'm really excited for moving forward is I feel like I've acquired a lot of knowledge about the data, and I feel like there's also a lot I don't know about, and I see that as like a very kind of mutually symbiotic relationship where just going through the research can inform the data and what can be done. So it's almost like a thought partnership, which I'm really looking forward to. And I've already connected with some people and we're paving the path. So thank you all for your time. And honestly, all
You
of
have,
this couldn't have been done without help from LCB along the way.
I'm sorry, are you guys able to hear us?
We can hear you now, David.
I can't hear you now, Jim.
Uh-oh. We can't,
Oh, there
we
you
can
are.
hear you. Oh, we can
Okay,
hear
I'm
you.
sorry. we've had some technical issues. I did have a couple of questions, and I'll.
Could you
I
hear
know
all of could you hear all of Armani's report out?
almost all of it. Yep. Yeah.
Okay.
Yeah. But if I can, let me ask a quick question. One on the interim studies, whatever we want to call those. Do you have to, does the board approve each one of those, or can you come up with what you think needs to be done in between the major studies?
Yeah, for each of the interims, like we don't go through like full board approval because all of it's in service to the like larger project that was already put on our plate. The board is in the loop on what we're doing, but no, we don't go through a formal approval process.
It's always good to keep your board in the loop.
Yeah.
That was for the audience here. The other question, and you addressed this, but just, I don't quite understand on like what impact, I'm thinking particularly about the high school, the adolescent questions. Does the study account for those socioeconomic differences? Like if there was a test area that didn't have a retail outlet, but had the exact same economics, socioeconomic as, I mean, what would that find? Isn't, use higher in a lower income area, et cetera? Is the study adjust for all that, or?
Yeah, that is a great question. So yeah, maybe I wasn't clear enough. So two things. One is we do adjust for measurable differences. So like we do account for, unemployment rate, other socioeconomics indicators, population, things like that. For the high school one, we also account for school characteristics themselves. So like the population breakout of the school or percent low income at the school or teacher to student ratio. So we account for as much as we can because of the reality that as you just pointed out, different economic indicators predict different substance and cannabis use behaviors. So we're accounting for a lot of it. This is why I kind of really wanted to emphasize the lack of randomness. There is also only so much we can account for. If retailers are locating in neighborhoods with higher use before they even opened, there's only so much we can do about that. But we do account for a lot of those relevant indicators.
Great. Okay. Well, thank you so much for coming and taking the time to do this and for all the work that you guys do. I've always been interested in and relied on a lot of what you've done over there. So appreciate your work on this a lot.
Awesome. Happy to, be there and looking forward to continued partnership.
Yeah.
Great. Thank you.
Thank you.
Thank you.
Okay. I'm going to just swap the thing here real quick. We're going to move to our executive session. At this point, this is an executive session to discuss legal matters relating to litigation or potential litigation to which the agency is or is likely to become a party. We're going to expect this will take about 30 minutes, but we won't have any business at the end. We'll skip our final reports today. So after the executive session, I'll just come back and adjourn the meeting. So with that, if everybody will just stand by, we'll have to clear the room here and we'll go into executive session. You guys want to hear? We can microphones. Jim and I'll hear more clearly. Everyone can come up to the table if they want. It's all right. If you talk, we're going to need you up here.
Particular reason to be here. Just a fair.
Okay, we're in executive session. I don't see Jim, but I assume he's there. Can you guys see Jim? Jim, are you there? Ollie, can you hear me?
Yes, yes.
Okay. Okay.
Should be in there.
He's showing up there. Jim, if you're on and can hear her, speak up, raise your hand. Why does it say 8 participants?
You know, list of participants.
See if I can move the mouse back in. There we go. Jim's the ninth.
We're the other 8.
You guys, you're on the calendar invite.
Jim, are you on? Jim,
It keeps bumping down. Hold on.
you know, he'll have to catch up no time if he's not, but as long as we're sure we're all just here, everybody else is on and nobody who's not supposed to be is on.
Let me
Best,
double check.
okay.
There it is.
Oh, there's Jim. Jim, can you hear us? You're muted. I can't hear you.
Can you hear me now?
Yes, yes, and you can hear us?
Oh, you got kicked.
That's weird.
We have my phone, or should we actually phone?
Yeah, we could add up by phone.
You can't get into the executive session by.
What do you mean? No, I mean, we could just put them,
Oh,
we
yeah,
just
you can
call
just
the
dial
phone,
in.
put them on
Or
here.
call from there?
No, that
No,
one.
that gets into public. meeting.
But let's just, can you just call them on your cell phone and.
Hello?
There it is.
Now I can, got a phone call and I'm here.
Okay, we were gonna call you on the cell phone just in case this didn't work, but it looks like it,
I was on for a bit and got kicked off last time, so hopefully this works.
yeah,
Hold on just a
I
second.
am, yeah.
Chair, if you can hold, please.
Yep, I'm holding.
You just got kicked off. Jim just got kicked off again.
Yeah, and I still see a bunch of attendees on here.
Hey, Jim. Well, hang on, I'll just put you on speakerphone.
No, I think we have people. So we can't start yet anyhow. But you can put them on spirit. We're on hold.
So,
We're going to stand at ease. That's true.
We're gonna have to, I can't get you to stay in the room.
Let's do that. And then, somebody have Ollie's.
We can run the same way.
All right, let's do that.
All right, hang on, Jim. I'm gonna try to play operator.
And then you'll just mute the meeting room and turn off the cameras in here. You can hang up on Teams, stay on the phone, but hang up on Teams.
Okay.
Okay, we are done with our executive session to discuss legal matters. And we will adjourn the caucus. Thanks, everybody.